My name is Megan Wilson, and this is my physical examination assignment for NR509. I am the parent of Madison Wilson, and I give my permission for this examination to be uploaded to Chamberlain College of Nursing for grading purposes. So I'm going to do a room scan. All right. We didn't have any other better options for location. All right. Nothing here, nothing on the floor, and nothing on the beds. Let's see if I can get a step back up here. Okay. All right, so first I'm going to begin by inspecting her. I'm going to introduce myself to you. My name is Megan. I'm going to be doing a physical examination on you today. I'm going to inspect her head first. I note that it is normocephalic and midline on her body. Looking at her face, it is symmetrical, no redness, no lesions, no visible signs of injury. I'm then going to assess her lymph nodes, beginning with the preauricular lymph nodes in front of her ear, postauricular behind her ear, occipital behind her head, tonsillar, submandibular, and submental at the tip of her chin, and her hair. Then anterior cervical on her neck, and posterior cervical also on her neck, and supraclavicular above her collarbones, clavicles. All right, then I am going to, all of her lymph nodes are soft and non-tender and mobile. Then I'm going to check cranial nerve 5, which has the trigeminal nerve and has a sensory and motor component. For the motor component, I'm going to palpate her masseter muscle and have her clench her jaw. And I don't feel any distortions, and she seems to have good strength. For the sensory component, I'm going to have you close your eyes and let me know what side of your face I'm touching, or what part of your face I'm touching.
Left cheek, chin, bridge of my nose, forehead, right cheek.
Okay, so the trigeminal nerve, cranial nerve 5 is intact. Then I'm going to check cranial nerve 7, which is the facial nerve, and I'm going to have you smile and frown, and then puff out your cheeks. All right, and then raise your eyebrows and pucker your lips. And she can do all of those motions smoothly and without any pain. So I would say cranial nerve 7, the facial nerve, is also intact. Then I'm going to move on to her ears and inspect her outer ears. Move your hair back a little bit. Her ears look symmetrical. I don't see any visible deformities or injuries, no lesions on her ears. Then I'm going to look in her external auditory canal with my otoscope. And I'm going to pull her pinna up and back. Looking in the external auditory canal, I don't see any redness or drainage, no swelling, no excess cerumen. Her tympanic membrane is visible and pearly gray. I can see her anatomical shapes, and I don't see any middle ear effusion. So her right ear is healthy. Let's see if I can get you to see me on the left. There we go. All right, same thing on the left ear, pinna up and back. And this external auditory canal is also clear of any cerumen, no drainage, no swelling, no redness. Tympanic membrane is visible and pearly gray, and I can see all of her anatomical shapes. And I don't see any middle ear effusion in this ear also. All right. Next we're going to check, I'm going to palpate her pinna and make sure I don't feel any nodules or masses, and she doesn't have any tenderness while I'm doing that. I'm going to check cranial nerve 8, which is the acoustic nerve, and test your hearing. So I'm going to step behind you, have you close your left ear, and I'm going to stand behind you and cover my mouth and say
1, 2, 3.
And she repeated that accurately. I'm going to do the other side. Close your other ear. Cat, dog, mouse.
Cat, dog, mouse.
All right, and she recited that accurately as well. So cranial nerve 8, the acoustic nerve, is also intact. All right, moving on to her eyes. I'm inspecting her sclera. Her sclera are white and clear, and her conjunctiva are pink and moist. Then we're going to check cranial nerve 2, the optic nerve, and I'm going to use a Snellen chart and stand 6 feet away from her off camera for a second. I'm going to have you close your left eye, and read the lowest line possible.
LTFP8.
All right, and then close your other eye and lowest line possible.
LTFP8.
Perfect, and open both eyes and lowest line possible.
LTFP8.
Perfect. She has 20/20 vision in both eyes and can see that very clearly, so her cranial nerve 2, optic nerve, is also intact. Then we are going to check cranial nerve 3, which is the oculomotor nerve, and assess her pupillary response to light. So I'm going to use the light of my ophthalmoscope and let you look straight ahead. And we're checking for pupillary constriction to light. All right, and her pupils are equal, round, and reactive to light. They both constrict equally, and they're about 2 millimeters in size. Then we are going to check cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens. So I'm going to do that using an H pattern, and I'm going to have you just look straight ahead at my fingers, follow them with your eyes and not your head. Perfect. So cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens are also intact. All right, moving on from the eyes, I am going to inspect her nose and note that it is symmetrical and midline on her face. I don't see any visible deformities or lesions. I'm going to inspect her nares with the speculum of my otoscope again with a fresh tip. And so I'm going to have you look straight ahead, and I'm going to tilt your nose upward and look in your right nostril. Her nasal turbinates are pink and moist, and when I angle medially, her septum does not appear to be deviated. I don't see any redness, any excess drainage in her nose. Moving on to the left nare. Same thing, I don't see any redness, no lesions. Angled medially, I don't see any septal deviation. And her nasal turbinates are also pink and moist on the left side. So her nose looks pretty healthy. All right. Moving on from that, I'm going to check her frontal and maxillary sinuses. So I'm going to palpate your frontal sinuses here. You let me know if you have any tenderness. Yes or no? All right. And then maxillary sinuses, same thing. Any tenderness? All right. So no tenderness on her sinuses. So we're going to move on to throat and mouth. Looking at her lips, they are pink and moist. I don't see any dryness, no cracking. Looking at her teeth, I'm just going to use the light of the otoscope here for extra visibility. Looking at her teeth, she does have orthodontics present. No decay, no cracking on her teeth. And moving on to buccal mucosa. Well, first I'm going to look at her gums. Her gingiva are pink and moist. I don't see any signs of gingivitis. And then open your mouth for me. I'm going to look at her cheeks. Her buccal mucosa on both sides is pink and moist. Her tongue is smooth and pink. And go ahead and stick your tongue out. Looking at the hard and soft palate, both are pink and moist. Lower your tongue if you can. All right, and then her posterior pharynx is pink and moist without any exudates or redness. Lift your tongue up to the roof of your mouth. Floor of her mouth is also pink and moist, no lesions present. And then let me try to look at your tonsils. She does have tonsils present. They are about a grade 2. I don't see any erythema or exudates on her tonsils either. All right, so we're going to check cranial nerve 10, which is the vagus nerve. I'm going to have you stick your tongue out and say ah. All right, and her uvula and soft palate rise symmetrically with phonation. So cranial nerve 10, the vagus nerve, is intact. Then I'm going to check cranial nerve 12, which is the hypoglossal nerve. So I'll have you stick your tongue out and move it side to side. All right, she's able to do that smoothly. So cranial nerve 12 is also intact. Then I'm going to palpate her TMJ. So I'm going to put my fingers on her temporomandibular joint and have you open and close your mouth. All right, and I don't feel any subluxations, no crepitus, no clicking, and she didn't appear to have any tenderness while we did that. She had good strength with that as well. Moving on to your neck. I'm inspecting her neck. It's symmetrical, it's midline, no visible deformities or injuries. I'm going to palpate your trachea. Tilt your head back a little bit. There we go. I'm palpating her trachea. It is also symmetrical, straight and midline. To palpate her thyroid, I'm going to find her cricoid process and put my other hand in her suprasternal notch, and the area in between my fingers is where I'm going to palpate. I'm going to retract the skin to one side and have you swallow. All right, and then same thing, the other side, retract the skin and swallow. All right, so her thyroid is palpable, non-tender, no enlargement felt. I'm going to palpate her carotid arteries. With the right one, it's to the right of the trachea, and we're doing one at a time here so we don't make her pass out. All right, right carotid artery is bounding, and left carotid artery to the left of the trachea. And same thing, that one is bounding as well. I'm going to auscultate those arteries, and I'm listening for any bruit in either one. We're going to use the bell of the stethoscope for this one, and you just look straight. And I don't hear any bruit on the right side. And I don't hear any bruit on the left side. All right, and then last, before we move on, we're going to check cranial nerve 11, which is the spinal accessory nerve. So I'm going to put my hands on your shoulders and have you try to shrug against resistance. All right, and she has good 5/5 strength bilaterally. So cranial nerve 11, the spinal accessory nerve, is intact. Then I'm going to move on to listening to her heart sounds. places. Beginning with the diaphragm on my stethoscope, we're going in the second intercostal space for the aortic on the right sternal border. The second intercostal space on the left sternal border is the pulmonic. Third intercostal space, left sternal border, is Erb's point. Fourth intercostal space, left sternal border, is the tricuspid valve. And fifth intercostal space, midclavicular line, is the mitral valve. All right, same thing. We're going to use the bell of the stethoscope now to listen to all 5 places again. So for the aortic, second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid valve, fourth intercostal space, left sternal border. And mitral valve, fifth intercostal space, midclavicular line. Okay, and I'm able to hear S1 and S2 with no murmurs, no clicking, and no adventitious heart sounds. Moving on to her lungs, I'm inspecting her chest primarily to make sure there's symmetry. I don't see any barrel chest, any visible deformities. And then we're going to auscultate your anterior breath sounds. 6 places on the anterior chest. Let's flip this back to the diaphragm, beginning in the intercostal spaces. And you can take little breaths with each movement. Her anterior breath sounds are clear to auscultation. I don't hear any wheezes, crackles, or other adventitious lung sounds. So then I'm going to move on to her posterior chest. I'm going to have you stand up so the camera can see where I'm listening. You'll stand up and turn around. Okay, right there is good. Sorry, we have limited space here. All right, posterior chest, can you move your hair for me? All right, 8 spaces to listen to on the posterior chest, beginning above the scapula. And you'll take breaths again. And then we're going to listen to the lateral right middle lobe. One more. Perfect. And then left lateral. All right, and then you can have a seat. So her posterior breath sounds are also clear to auscultation. Again, no wheezes, crackles, or other adventitious lung sounds. All right, then we are going to move on to your upper extremities. So I'm going to look at the hands and fingers, the joints of the hands and fingers, and I don't see any deformities, no bony nodules, bony prominences. We're going to check capillary refill. So I'm going to compress one fingernail until it turns white, and the blood does return within 3 seconds. Same thing on the left hand. Till it turns white, and the blood does return within 3 seconds. So she has good capillary refill bilaterally. I'm going to check her radial pulses. They are 2+ bilaterally. And then I'm going to check your grip strength and have you squeeze my hands hard as you can. Good deal. She has 5 out of 5 strength on the right and left. Then I'm going to check your active range of motion. I'm going to have you do flexion and extension. All right, so she has good smooth range of motion. I'm going to check your bicep and tricep strength, so I'm going to have you flex your arms against resistance. Pull to you. All right, and then try to push back against me. All right, so she has 5 out of 5 strength bilaterally for her elbows. We're going to do passive range of motion of your shoulder. So if you'll just kind of relax and let me move you, we're going to do flexion, extension, it's a little hard to do sitting down, internal rotation, external rotation, and then abduction and adduction past the midline. So she has smooth range of motion, or smooth passive range of motion with no pain on her shoulder. We're only doing one side of range of motion for this exam. After that, I am going to check her cerebellar coordination. So I'm going to have you take your thumb and touch each finger one by one, and then try to increase your speed as you go. Just keep going back and forth. She's able to do that swiftly and smoothly. I'm going to have you place your hands on your thighs, flip them over, and then flip, 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 increasing speed. Perfect. So she has good cerebellar coordination. Then we are going to check her deep tendon reflexes, again, just on one side for this exam. So I'm going to support her arm a little bit and put my thumb in her antecubital fossa and strike my thumbnail with the pointy end of the reflex hammer. All right, and she has a good response there for the bicep. Moving on to the patella for deep tendon reflex, I'm going to use the flat end of my reflex hammer. And we have a good response there as well. And then I'm not sure if you can see the ankle one. I want to be able to see it on camera. I'm going to move the camera a little bit so we can see this part. All right, I'm going to have you just relax your foot, and I'm going to dorsiflex the foot a little bit and use the flat end of the reflex hammer on her Achilles. There we go. All right, and try to put the camera back where it goes. Okay. All right, so her deep tendon reflexes are all with a good response. So then we are done with the upper extremities. Now I'm gonna have you move on to the abdomen. I'm gonna have you lay crossways so the camera can still see you. I'm gonna move some of these things out of the way. All right, can you scoot back just a little bit? Okay, perfect. So I'm gonna expose the patient's abdomen. Put your shirts down just a little bit. Makes you relevant. Okay. So first, for the abdomen, I'm going to be inspecting, auscultating, percussing, and then palpating. So inspecting for contour, it looks symmetrical. I don't see any masses or enlargement anywhere. Then I'm going to auscultate for bowel sounds in all 4 quadrants, beginning with the right lower. Her bowel sounds are present and normal active in all 4 quadrants. So then I am going to auscultate the major arteries in the abdomen. The first one is the aorta, right below the xiphoid process. And actually, I believe this is supposed to be with the bell of my stethoscope, so I'm going to switch up to the bell and start over to the aorta below the xiphoid process. All right, the left and right renal are above the umbilicus and lateral to the left and right, so beginning with the right one. The left one. All right, and then the left and right iliac are below the umbilicus and lateral to the left and right again. So beginning with the right one. And the left one. All right, and I don't hear any bruits in any of those major arteries. So then I'm going to percuss her abdomen in all 4 quadrants, striking my 3rd finger. Okay, and I don't hear any tympany, no hyperresonance, no dullness, no flatness. So that is an expected finding as well. Then I'm going to palpate, do a light palpation on her abdomen, also beginning in the right lower quadrant. You just let me know if you have any pain or tenderness. All right, and I don't feel any masses, no enlargement, and I did not see any grimacing or guarding from the patient, so I do not believe she has any tenderness on that as well. Then I'm going to palpate her liver and spleen. For the liver, I'm going to place my left hand underneath her back, my right hand at her costovertebral angle, and have her take a deep breath in while I press inward and upward. I'm going to take a deep breath. All right, and I can just barely palpate the bottom edge of her liver. For the spleen, I'm going to have you rotate your bottom half towards me a little bit. There we go. Place my left hand behind her, right hand costovertebral angle, and take a deep breath. I'm pressing upward and inward. And I'm not able to palpate her spleen, which is a normal and expected finding for the abdomen. All right, so then I'm going to pull your shirt down for you. And then while she's still laying down, I'm inspecting her lower extremities. I don't see any, again, deformities, injuries, lesions, any redness on her legs. I don't see any edema. Then I'm going to do passive range of motion on her hip. Hopefully we can see this in the video. All right, so if you'll just relax and let me move you. To flex her hip, I'm flexing her knee. All right, and we're not doing extension of the hip for this video. So then I'm going to do flexion, internal rotation, external rotation. Try to keep that leg straight for me if you can. Rotation. All right, and abduction and adduction past the midline. All right, and she has good, smooth, painless, passive range of motion on her hips. For her knees, I'm gonna have you flex and extend your knees, so go ahead and bend both knees up. Good deal, and then extend them. All right, so she has good active range of motion on her knees. Then we're gonna check the strength of her knees, and I'm gonna have her flex and extend against resistance, but to do that I'll have to step off camera to the side a little bit. You should still be able to see her knees. Go ahead and flex your knees up to the bed for me. All right, and then try to extend against resistance. All right, and then try to flex against resistance. Perfect. So she has good 5 out of 5 strength bilaterally on her knees. For this part, I'm gonna have you still lay down, but face the other way for me so he can see your ankles.
Like this?
Just lay on your back facing that way. Oh. Okay, so then we're gonna do passive range of motion of her ankles. So I'm gonna support this foot. We're gonna dorsiflex, plantar flex, and rotation. Any pain with that? So she has good passive range of motion on her ankles. I'm gonna have you, we're gonna check your ankle strength. So I'm gonna have you dorsiflex your foot and try to bend it towards you against resistance. And plantar flex against resistance, perfect. So she has good active range of motion and good strength, 5 out of 5 bilaterally in her ankles. Let me think if I'm forgetting anything on the ankles. I'm gonna check her dorsalis pedis pulses on the tops of her feet. And they are 2+ bilaterally. And I believe that's it for lower extremities. So then I'm gonna have the patient stand up and we're gonna move on to inspecting her spine. And I'm gonna try to turn the camera just a little bit without knocking it over. Ooh. Well, goodness. Okay, again, sorry. Okay, so if you can just stand right here, kind of in the camera and turn around. All right, gonna move your hair for me. All right, so I'm inspecting her spine. I'm looking for the expected curvature of her spine, making sure there's no misalignment. It does seem straight, symmetrical, and midline. Then if you'll turn around again. All right, I'm gonna have you do flexion and bend over. All right, and stand up. And then extension, you're gonna lean back. All right, so good flexion and extension. I'm gonna have you turn to your left or your right, okay? And then turn to the other side. All right, good rotation to both sides. And then lateral flexion, you may have to turn your body this way so you don't hit the bed. Lateral flexion, bending over to the left and bending over to the right. Perfect. All right, so she has good range of motion on her spine. And then last but not least, I am going to have her, try to again move the camera. I'm gonna have you take a couple steps. If you'll start here and take a couple steps that way. And then a couple steps back to me. All right, I don't see any gait dysfunction. She seems steady and balanced. To check the balance again, we're also gonna check the Romberg sign, if I can get the camera to stay still. Okay, for Romberg sign, I am going to have you just stand perfectly still with your eyes closed. And I'm gonna have my arms here for safety. And we're looking for any swaying. All right, and she has no swaying, so that would be a negative Romberg sign. Before I complete the video, I realized that I did forget to check for Bloomberg sign on the abdomen, so I'm gonna have you lay back down. Sideways is fine. And I'm gonna try to turn the camera. All right, and for Bloomberg sign, I'm gonna take my hand at a 90-degree angle, press it down, and if she has any pain on the rebound, that would be a positive Bloomberg sign. So let's see, I'm gonna press straight down and let go. Any pain with that? All right, and she did not have any pain or tenderness when I retracted my hand, so that is a negative Romberg or negative Bloomberg sign. We had a negative Romberg sign as well. All right, so you can go ahead and sit up. You are all done. And this completes and concludes my physical examination assessment for NR509. Thank you.